Good morning, students. Today we'll see continuation of the wrist joint. Next topic learn relations. Okay. Anteriorly that is a wrist joint. The wrist joint anterior and posterior. Okay. Anteriorly is present on tendon. What is a tendon? The tendon is nothing but is the attachment of the end of the muscle. The end of the muscle and the bony points attached to the point is a tendon. Okay, the tendon is mainly for execute the functions of the muscle. Okay, movement of the muscle. Okay, first anteriorly present on the flexor digitorum superficialis. Flexor digitorum superficialis. This muscle mainly helped for either in the forefinger flexion movement, forefinger flexion movement of the this finger. Then flexor digitorum profundus. This muscle keep on the either deepest layer, that is a superficial. This profundus is the deeper layer of this area. That is a deeper layer. This also help on the this forefinger flexion movement. Okay. Then pollicis means thumb. Okay. This means fingers. Pollicis means thumb. The flexor pollicis longus. This muscle mainly help for thumb flexion. This movement help for flexor pollicis longus tendon. Then flexor carpi ulnaris, flexor carpi radialis. The flexor carpi radialis is act on this area. This flexor carpi ulnaris, flexor carpi radialis. This flexor ulnaris mainly function of the flexion of the wrist. Wrist flexion help. Then flexor radialis also help for wrist flexion. Okay. Then nose, median. This side is a median ulnar nerve. The center is the median nerve. These all nerves are present in the anteriorly. Okay. Then laterally. Okay. Laterally is mainly for present on the radial artery. Is feel on the palpation. Okay. Doctors are nothing about is feel palpate this artery pulsation. It is called. It is this area suitable for pulsation. Mainly for this radial artery pulsation feel on this area laterally. Then posteriorly, the posterior this surface. Okay, mainly for tendon abductor pollicis longus tendon. Abductor pollicis longus tendon. This thumb movement abduction. This is the abduction adduction. This adduction. This movement mainly for this movement mainly helpful for abductor pollicis longus tendon. Then extensor pollicis brevis. Okay, now this is extension movement, flexion, extension. This extension movement mainly helpful for extensor pollicis brevis tendon. Okay. Then the abductor pollicis longus tendon mainly helpful for abduction. Abduction for thumb. Okay. Then extensor carpi radialis. This surface and extensor carpi radialis longus, extensor carpi radialis brevis. Okay. Brevis is the short muscle, longest long muscle. This mainly for helpful for wrist extension. Wrist extension is helpful movement. Then extensor pollicis longus tendon also helpful for thumb extension. Thumb extension. Then extensor indicis. The extensor indicis is also there mainly for this area. Distal finger. This area mainly for this finger extension. Okay. This is for extensor digitorum. Mainly this area is mainly for extensor indicis. Okay. The extensor digitorum mainly for this area extension. Okay. Then extensor digitorum minimi also the extension of this area. The extensor carpi ulnaris also is at this area mainly for extension of wrist. Then blood and nose supply of the wrist joint. Okay. Now blood supply mainly for anterior and posterior carpal arches. Anterior and posterior carpal arches formed by the branches of radial and ulnar arteries. Okay. Then nose supply. What are the nose supply are in this area? Anterior and posterior intraosseous nerve. Okay. Then movements. Wrist joint mainly occurs the flexion, extension, abduction, adduction, or circumflexion movement mainly occurs. Okay. In first of all, the first movement flexion. The flexion mainly occurs at the this is the radiocarpal joint. This is the midcarpal joint. These areas mainly act on this flexion movement. Okay. Muscle responsible for flexion: flexor carpi ulnaris, flexor carpi radialis, palmaris longus. Okay. Assisted muscles also called as flexor digitorum superficialis, flexor digitorum profundus, and flexor pollicis longus. Why it is assisted muscle? One, the why wrist flexion also flexed for this finger flexion also. Why is action? It is called passive insufficiency. Okay, this movement happen. All automatically this movement also happen. Okay, is helped for mainly this muscle. Okay. Then movement of extension mainly for wrist joint. This is a fulcrum is the wrist joint. The main range is the 0 to 50 degree. Okay. It helped for this main muscle extensor carpi radialis, extensor carpi radialis longus, extensor carpi radialis brevis, then extensor carpi ulnaris. Assisted muscles also extensor digitorum, extensor indicis, extensor digiti minimi, and extensor pollicis longus. Then movements of abduction mainly for midcarpal joint. We say midcarpal joint range 15 degree. We helped for flexor carpi ulnaris, flexor carpi radialis, and extensor carpi radialis longus, extensor carpi radialis brevis. Assisted muscle for abductor pollicis longus, extensor pollicis longus, and extensor pollicis brevis. Then adduction movement mainly at the wrist joint 0 to 50 degree. Main muscles of the flexor carpi ulnaris and extensor carpi ulnaris. Then circumflexion movements for combination of flexion, extension, abduction, adduction. Okay, okay, students, you will see about